The chair recognizes the gentlewoman from Wyoming.
Thank you, Mr. Chairman. I rise in favor of my amendment number 71 to H.R. 4368, which prevents American tax dollars from being used to fund the World Health Organization. In the bill currently before us, the FDA is seeking to provide funding to the WHO to advance and expand tobacco product regulation under the Building Research Capacity in Global Tobacco Product Regulation grant program. The United States has consistently been the largest contributor to the WHO in the world, topping the charts in 2020 at over $116 million, nearly twice as much as China, who contributed about 12% of the organization's total that same year. This is the same WHO who refused to act on or publicize warnings from Taiwan that the new respiratory infection, now known as COVID-19, was a threat to humans. They instead chose to echo the lies coming out of China that there was no evidence of human-to-human transmission. Mr. Chairman, my constituents sent me to Washington, D.C. with the mandate to stop sending taxpayer dollars to the WHO, an entity which covers for the CCP, helped cover up the COVID outbreak, and routinely attempts to infringe on the sovereignty of Americans in furtherance of its globalist agenda. I say all this to repeat that the American people rightly know that the WHO is a corrupt organization which bends to the Chinese Communist Party and does not deserve a cent of American tax dollars, no matter through which account this money is distributed. And with that, Mr. Chairman, I reserve.
General Lady reserves. For what purpose does the gentleman from Georgia rise?
I rise to claim time in opposition to this amendment.
Gentleman is recognized for 5 minutes.
Setting aside whether this amendment is misplaced in the Agriculture Appropriations Bill, this amendment is simply bad policy. We're still fighting the lingering effects of a once-in-a-lifetime pandemic, and attempts to cut funding for the World Health Organization would hamper work to monitor any new variants of COVID-19. Moreover, the World Health Organization's work extends far beyond just responding to COVID. Cutting funds for the World Health Organization will affect efforts on other diseases and illnesses, including polio or the flu. Efforts to disengage with the WHO through our bill are misguided and do nothing to address any concerns about accountability, transparency, or cost efficiency. This is not a good amendment. I urge its defeat, and I reserve the balance of my time.
Gentleman reserves. The gentlewoman from Wyoming is recognized.
Yes, I yield 2 minutes to the gentlelady from Indiana.
The gentlelady from Indiana is recognized.
Thank you, Mr. Chairman. I rise in support of the amendment. I thank the gentlelady from Wyoming for yielding and for her leadership on this issue. I share the concern of many of my constituents with respect to the World Health Organization or the WHO, particularly with respect to the recent track record related to the COVID-19 pandemic. In fact, I supported President Trump's efforts to remove the United States from the WHO. Our tax dollars are precious. Tax dollars should only be spent on necessary programs and necessary programs only. We should be prioritizing our limited resources within organizations that have a track record of delivering for the American people. Frankly, based on the WHO's own record, I struggle to say the WHO fits into that category. We have had to make a lot of tough decisions about what to spend taxpayer dollars on, about what to cut and what not to cut. An international organization with a dangerous record of protecting the world from the spread of diseases just does not meet the simple threshold. Are American taxpayers getting what they're paying for? Again, I thank the gentlelady from Wyoming for her efforts to bring this to the floor. I urge my colleagues to support this amendment, and I yield back the balance of my time.
Gentlelady yields.
I reserve.
Gentlewoman from Wyoming is recognized.
Yes, I reserve the remainder of my time.
Gentlelady reserves. The gentleman from Georgia is recognized.
I yield back.
The gentleman yields back. Gentlelady from
Yes.
Wyoming is recognized.
I'm ready to close. It is simply not in the interest of the Americans to have their tax dollars going towards a program that studies the health burden of tobacco in other countries. This is simply an attempt to export the federal nanny state into other countries through one of the most corrupt international organizations ever known. What we should be focusing on is domestic deregulation, not global governance. After everything we've been through over the last few years, after witnessing the WHO's complete and utter incompetence during the spread of COVID-19, after witnessing them turn a blind eye to time and time again to the CCP's culpability, you would think that we'd have learned that American tax dollars should go to the American priorities and not the priorities of our adversaries. Having any funding for the WHO in any appropriations bill is inconsistent with the stated goal of the 118th Congress to defund the WHO completely. They are a failed puppet organization of Communist China. I urge my colleagues on both sides of the aisle to support my amendment, and thank you, Mr. Chairman. I reserve.
I'm sorry. The gentlelady has the only time remaining.
Thank you. Again, I urge my colleagues to support this amendment. Thank you. And I yield.
All right. The question is on the amendment offered by the gentlewoman from Wyoming. Those in favor say aye. Those in favor say no. Opinion of the chair, the ayes have it. The amendment is agreed to.